Hola amigos, how are you today? This is Christina Luna and we are with Elizabeth, Vice President of Lehigh Valley Hospital, Pocono. Today we're going to talk about vaccines. All the questions, all the things you want to know about vaccines. Hello Elizabeth, how are you?
Hi, Christina. Happy New Year. And Happy New Year to all of you out there. I'm looking forward to better days ahead.
Yeah, and we have hope. I remember that you always have your little,
I do. I still have it with me, yes.
How are things in our community?
So we definitely have seen a resurgence of the virus. You know, it's definitely a second wave. A lot of it is due to gatherings of people, but also a lot of community exposure, you know, when people go out to shopping or, you know, to the grocery store. So it's definitely a resurgence.
A resurgence. But I want to thank you first because you recently gave us masks for the event of the Three Kings, and we distributed, thanks to the hospital, 100 masks. And these masks are more improved, right? Much more improved.
Yeah, they're fog-free, which I wear glasses all the time, and I have not fogged up my glasses. And so some of that is the material as well as the design.
Thank you for donating. Do you have one to show it to us now?
I do.
Oh, great.
This is the design. The loops, you know, are there to place behind your ears, and they're washable too.
Okay, great. Thank you so much. So you will see a huge amount of people around our community wearing the Lehigh Valley Hospital mask.
Well, thank you for doing your part, because masks do make a difference.
Yeah, they make a difference. But today let's talk about vaccines because it's a lot of questions, anxiety, people want to know. So people have been starting getting the vaccine here in Pennsylvania, right? Can you tell us a little bit more about it before we go to the questions that I gathered from the community? Some people are upset because some people that they know have been putting on posting on social media that they have received the vaccines, others that are sick haven't received it. So can you tell us a little bit how we're starting and how this is working?
So each state has a different vaccine plan. For the state of Pennsylvania, they have allowed us to start vaccinating frontline healthcare workers. So people that are working in the hospital and all hospital employees. We also are able to vaccinate firefighters, emergency medical services, so your paramedics, your EMTs, firefighters, National Guard, teachers, grocery workers, dentists, those that are high risk exposure that take care of or care for COVID patients.
So these are currently getting the vaccine, phase 1?
Yes. Well, it's phase 1A and phase 1B.
Okay, great. And where are we now? What phase are we?
We're in 1B. If anybody's interested, on the Pennsylvania website, you can go and pull up the whole plan, and it outlines all of the phases. What it doesn't have is the timing, because some of that is dependent upon how many vaccines the state receives. And that the allotment comes in week to week.
Okay, got it. So let's start with the questions also. What is the vaccine? Well, you were talking about the distribution plan in Pennsylvania. And when can people that are not in the medical field and are in high risk can get it? I've heard that people say, well, you know, my mom or my family member is in dialysis, somebody's in cancer, somebody's diabetes 1, over 65. What is the plan with these people that are very anxious to get it?
So there's two types of vaccines available. One is the Pfizer vaccine that requires 2 doses, 21 days apart. The second is a vaccine called Moderna, which is 2 doses as well, 28 days apart. For those people that I didn't mention previously, the next phase would be, and this is according to the Pennsylvania plan, would be those who would be high risk, 75 and older, and then moving down to 65 and older, and then taking a look at certain conditions. What my encouragement to all of you in the community is to go to mylvhn.org. Even if you don't go to Lehigh Valley Health Network, sign up in mylvhn.org or download the app and sign up. And what will happen is, as soon as we are able to vaccinate, when the state gives us approval, you will get notified electronically to go in and then schedule an appointment.
Okay. You
And
told
the reason why the appointment is so important is we want to make sure we have enough doses, because we get regular doses from the state, and we want to make sure we have enough doses to vaccinate the community.
do you think this next phase will be around, I know you don't have a timeline yet, but will be around the next month, the next few weeks? Can we expect before Easter, let's say, that most people will be vaccinated or will go through all the phases?
I think that's very hard to answer. And the reason for that is, we have a new president coming in. And that president has communicated that he is going to distribute the vaccine differently than the previous president. And so that may change how many doses we get and how many people we can vaccinate. So I'm hesitant to give a timeline.
Let's hope for the best. Now, let's talk about the cost. Is there a cost towards the vaccine? And what about people that don't have any insurance?
Okay, we are not charging for the vaccine at all. There
Wow,
will be no
really?
charge. Yes.
Wow, that's a great news.
Yes, we have communicated that we will give the vaccine for free. You don't need insurance to receive the vaccine, because we're not going to be charging, this won't come out of any insurance. It will be free to anyone who wishes to receive it.
Mm-hmm. What would you say to, what are the people that should receive it? Is there anybody that shouldn't receive it?
There is, so aside from ages, because the two vaccines that are available, it's for 16, one is for 16 years old, the other's for 18.
Mm-hmm.
We don't have vaccines for less than 16 right now, but for anybody who's older than that, the only contraindication to getting vaccinated is if you had a reaction, a severe reaction to the first vaccine. So essentially everyone should get vaccinated.
And what would you tell to those people that don't want to get vaccinated, or they are saying, I hear a lot of that, I don't want to be a guinea pig, I'm going to wait? What would you say to those people that are afraid of that?
I would say that the vaccines are safe. There is new information coming out every day. There are very few people out of the millions that have been vaccinated that have a reaction. So what we do is, once you get vaccinated, we observe you for 15 minutes if you have no allergic reactions. But if you have had allergic reactions in the past, we observe you for 30 minutes.
Okay.
And the vaccines are safe. That's what I can tell you.
And so if you don't get a reaction between 15 and 30 minutes, it means that you won't get a reaction probably?
Not necessarily. So what they're saying is, the first dose, we are seeing very few not a reaction, but symptoms.
Mm-hmm.
Second dose, because remember, that gives you the maximum benefit. Some people are experiencing a mild fever, maybe some aches and pains, which you can take Tylenol or Advil, and that will help.
Okay, that's great to know. And what about safety between vaccines? Because some people might think, oh, I got the vaccine, so now I can take my mask off. I don't have to, I can hug, kiss everybody. No.
No. So after the first dose, you have about 50% protection. After the second dose, it's 95% protection. But the studies, and this, we need more data, are showing that you could still be a carrier of the vaccine. So you may not get COVID, but you still are able to give COVID, because there are some people, about 40% of the population, that are walking around and they have no symptoms. So you could still be a carrier of the virus. Does that make sense?
That makes sense. After the first doses or after the second one too?
You could get COVID in between. Even after the second dose, you could still be a carrier of the virus.
For how long? No.
Just don't know that.
We don't know that. So even after the second doses, we still should wear masks, social distance, avoid too closeness.
We're going to have to, up until the point that at least 80% of the country gets vaccinated and has what's called herd immunity.
So that most people are vaccinated, so then that we can get rid of this virus, right?
That's
Um,
absolutely true.
what is the protocol of getting the vaccine? Do I need a referral from the doctor? How does that work? You say we download the LVHN chart, let's say.
Yeah, you will not need a referral. As soon as the state says, Christina, you can get vaccinated.
I will.
Okay, good for you. Thank you. You either will get notified through your LVHN portal. You'll get an email saying, Christina, you can either call this number, which, we have it available on lvhn.org, or you can go in through the portal and make your appointment. And what we're currently vaccinating in the hospital. But the plan is that once we get the go ahead, we will vaccinate in your physician's office, right? So you can go when you go to your doctor, just like when you go to your doctor now and you get a flu vaccine, you'll be able to get a COVID-19 vaccine.
So now let's talk about, people that have colds or people that have, symptoms that might be similar to COVID or had
Yes.
COVID. What about these people? Do they have to get vaccinated? Do they need, or they don't, or do they have to wait?
Okay. So if you have had COVID and you've been through the 14 days, you can get vaccinated and you should get vaccinated. Now, you have some immunity for a period of time. They think it's 3 months, but we're still encouraging people to get vaccinated. If you have cold or flu-like symptoms, because remember, those symptoms are very similar to COVID, you should get tested, right? You should either call your doctor, who will give you some advice, or you can go to one of our express cares, tell them you have symptoms that are like COVID, and they will do a COVID test. And then you must wait for the results and then either go into quarantine, right, for the 14 days, or if you have a cold or flu, you can go in and get a COVID vaccine.
Okay.
The only thing that thing that I want to explain is if you just got a flu shot, you must wait 14 days to get your COVID vaccine.
That's
Or
important.
if you got the shingle shot, you must wait 14 days to get your COVID vaccine. Any vaccinations that you've had, you have to wait 14 days.
Okay, that's very good and an important information that
Yes.
people will really appreciate. Okay, now some people have sent me some apps about that you can get online to get the vaccine. Can you tell us, is this as like a scam, or what about this? Do you know anything about this that you can tell us about these apps?
Currently, the only people that are vaccinating are the hospitals, because they were the ones that got the vaccines initially from the state. There may be other apps in other states that, if people live in New Jersey has a registration, a website that you can use. So it really depends on the state and when the state releases the vaccine for the different populations.
Okay, so we have to take into account our state. This is a
Yes.
state plan. So
Yes, that's exactly right.
They sent me an app from California, so I don't know, no way.
California may have a different vaccination plan than the state of Pennsylvania.
Okay, thank you very much. These are some very general and very important questions to start with. I'm sure there will be more information up to update in the near future, but tell us for now, this is great and really appreciate it. Is there anything else that you want to share with our community right from the bottom of your heart? You're so personable. People like that, how direct you are as a community health leader.
So I have a couple things. One is, I asked for the community's help. I say the power of life is in your hands, right? You have the power to make a difference in someone else's life by not passing on, if you do have the vaccine, to someone else. So please continue to wear a mask. And washing your hands and socially distancing. But my message is, like you said, one of hope, and that there are better days ahead, thanks to all of us coming together and supporting not only our hospital community, but our family and friends. And I really do believe that we will get through this together, and that there will be better days ahead for all of us.
Thank you, Elizabeth. Do you want to say something in Spanish? I know you know a little bit of Spanish to our Spanish-speaking people.
So I'm learning, but the only things I really know are agua, abuela, what's the pain, dolor, right?
Dolor.
Yes.
I'm going to show you one more now. Mascarilla.
Okay, teach me, because I want to learn.
Mascarilla. Mascarilla.
Mascarilla.
Yeah.
Okay.
Mascarilla.
Mascarilla.
Use su mascarilla. Use your mask. Use su mascarilla.
Oh, teach me that one again. Usi.
Su mascarilla.
Oh, I like that.
Su mascarilla. I'll write it for you.
Okay, great.
Su mascarilla.
Thank you.
Thank you, Elizabeth, Vice President of Lehigh Valley Hospital, Pocono. And this is Christina Luna for all of you. Please let us know in the comments what else you want to know, because Elizabeth and her team are always forward to answering the questions of our community. And this is a project that we need everybody involved. It's not the state, the government, the hospital's responsibility to take us out of this. It's a common effort.
Absolutely. Thank you.
Thank you so much, Elizabeth. Gracias, amigos. And make sure you tell us what you want to know. We'll give you the answers.